Well, I'm Dr. Shekar Narayanan. I'm a colon rectal surgeon. I work at Colon Rectal Care. We're a 4-person practice devoted purely to the care of patients afflicted with colon rectal diseases. Well, we're pretty excited about some of the unique things that we do at Colon Rectal Care. Probably the 3 biggest are what's called TEM, or transanal endoscopic microsurgery. It's been around in Europe for years, but came to favor in the United States over the last few years. The advantage of this procedure is for patients afflicted with low rectal cancers or polyps. We are able to remove them through the patient's natural anus. This usually just involves an overnight stay. There's minimal pain. The recovery is usually within a week. And oftentimes patients who previously would have to have abdominal surgery and potentially even a colostomy forever won't have to do that. And that's probably one of the most exciting things. The other 2 that we offer, being the first in the state to have performed it, was one called a STAR, or what's called a staple transanal rectal resection. Unfortunately, constipation is a common problem in the United States, and every once in a while there's a functional issue with the patient's own rectum. And this procedure allows them to be able to change their anatomy back to the way it was when they were younger, and really allow them to have a bowel movement fairly normally. And finally is an artificial anal sphincter, which basically patients who have had either a traumatic delivery and or some type of neurological problem where they cannot hold their stool, we can implant a prosthesis, which allow them to have some great quality of life and be able to go out and not worry where a bathroom is. And those are probably the 3 most exciting things that have come along. Of course, laparoscopic surgery, we were one of the first to perform colon operations that way for both cancer and diverticulitis. And we offer the full gambit of a unique approach to colon rectal diseases. One of the great things about laparoscopic or minimally invasive is recovery. Pain levels are much less, hospital stays are usually 1 to 2 days less. And where I really think patients benefit the most is the ability to do the activities of daily living and get back to work. Especially in this world, this economy, you got to get back there. And if you can save yourself 2-3 weeks in some situations, that ability to help your family and help yourself, I think, is invaluable. And what I really like is you have a feel of a family here, and you have specialists here, and you have the latest equipment here that allows physicians to do their job the best that they can. Nursing staff is superior, ancillary services is superior, and I think patients, especially in my 7 years being here now, always compliment both North and East about patient care and how much they enjoyed being at the hospital, though not wanting to be there. They had a great experience. My grandfather passed from rectal cancer. My father-in-law has had colon cancer come back a couple times. So everybody's got a personal issue, and I think on our office especially, we take this field and this job very seriously, that we are there to help them